So our topic is blood supply of the upper limb. Arteries of the upper limb. The arteries of the upper limb is vessel changes name as it passes through the different region. Like the first artery, the subclavian artery is the branch of brachiocephalic artery from the arch of the aorta. Then the subclavian artery, when it passes through the outer border of the first rib, we label it the axillary artery. When the axillary artery is actually passes from the lower border of the teres major, we label it the brachial artery. When the brachial artery lies in the cubital fossa, then it is divided into the radial and ulnar arteries. So, as I've already told you, the from the first branch of the aorta is the ascending aorta, and the ascending aorta will continue like the arch of the aorta. Then the third part is the descending aorta. Now the branches of the arch of the aorta, while for the right side there is the brachiocephalic artery, which is actually divided into the right subclavian artery and right common carotid artery. And for the left side, there are the two separate branches. From the arch of the aorta is the left subclavian artery and left common carotid artery. The subclavian artery is actually passes between the clavicle and first rib. It is divided into the three parts by the anterior scalene muscle, and the branches of the subclavian artery is the vertebral artery, internal thoracic artery, thyrocervical trunk, costocervical trunk, and dorsal scapular or descending scapular artery. As I've already told you, that the subclavian artery is actually divided by the anterior scalene muscle. While you are seeing here the anterior scalene muscle at the left side, the anterior scaleneus muscle, and at the lower portion, there are the different branches of the subclavian artery. First one is the vertebral, then the thyrocervical, and the internal thoracic artery. These are the branches from the right subclavian artery. And like you are saying here at the right side, the shadowed part is actually the second part of the subclavian artery, which is the area where the anterior scaleneus muscle is actually present. The part of the subclavian artery which is present proximal to the anterior scaleneus muscle is actually labeled at the first part, and the part that is present distal to the anterior scaleneus muscle is labeled like the third part of the subclavian artery. The branches of first part of the subclavian artery are the vertebral artery, thyrocervical trunk, and internal thoracic artery. And the branch of the second part of the subclavian artery is costocervical trunk. And the branch of the third part of the subclavian artery is dorsal scapular artery. As I have already told you, when the subclavian artery is passed from the outer border of the first rib, we label it the axillary artery, as you are seeing in this diagram. Now, the axillary artery is the central structure of the axilla. It extends from the outer border of the first rib to the inferior border of teres major muscle. It is actually divided into the three parts by the pectoralis minor muscle. At the subclavian artery, the anterior scaleneus muscle is actually dividing the subclavian artery. But at the axillary artery, pectoralis minor muscle divides the axillary artery into the three parts. Here you are seeing the pectoralis minor muscle, the first part of the axillary artery which is present proximal to pectoralis minor, second part which is present dorsal to pectoralis minor, and third part which is present distal to the pectoralis minor muscle. At the proximal portion, you are seeing the subclavian artery, first, second, and third part, and the anterior scaleneus muscle here. And the lower portion, the where the axillary artery is labeled the brachial artery, it is actually the lower border of teres major muscle, which is present here, the black arrow that is present here. The branches of the axillary arteries are the superior or supreme thoracic artery, thoracoacromial artery, lateral thoracic artery, subscapular artery, and the anterior humeral circumflex artery and posterior humeral circumflex artery. These are the branches of the axillary artery. While at the shoulder joint, actually the anastomosis occur between the branches of first part of subclavian and third part of the axillary artery. So why the anastomosis occur at the shoulder area? It is actually the region of the movement where the all of the movement that actually connects or the other movement of our body. It is actually proceeded through these joint, the shoulder joint, which is also called the glenohumeral joint. So to provide the continuous supply, blood supply to the shoulder joint, actually the anastomosis occur at the areas. So if the one or two branch or three branch will get obstructed, then the other branches will supply the blood to the area where the anastomosis is actually occurring. So at the shoulder area, branches from the subclavian arteries are the suprascapular artery and the superficial cervical artery. It is actually not labeled in the previous diagram because these are the small vessels. So that's why it is not labeled at the subclavian artery area. And the branches from the axillary artery for the shoulder anastomosis is subscapular artery, anterior humeral circumflex artery, and posterior humeral circumflex artery. Now you are saying the axillary artery here, and the branch of the axillary artery, the subscapular artery is like here, and the anterior and posterior humeral circumflex artery, which is actually encircling the surgical neck of the humerus, is actually present here. These are the branches from the axillary artery, and the branches from the subclavian artery, as we have studied, is the two branches, the suprascapular artery and superficial cervical artery. Now, the brachial artery is actually extends from the inferior border of the teres major muscle to its bifurcation in the bifurcation in the cubital fossa. It actually lies in the center of the cubital fossa and present medial to bicep and lateral to the median nerve. And it actually terminates by dividing into the radial and ulnar arteries at the level of radial neck in the cubital fossa. What are the branches of brachial artery? The main branches are the profunda brachii or deep brachial artery, superior ulnar collateral artery, and inferior ulnar collateral arteries. As you are seeing here, it is the brachial artery is start from the lower border of teres major to the cubital fossa, and the branches of the brachial artery are the profunda brachii and superior and inferior ulnar collateral arteries are the branches of brachial arteries. Now, at the elbow joint, the anastomosis occurs between the branches of brachial, radial, and ulnar arteries. So, the branches from the brachial artery, as we have already studied, the profunda brachii, superior ulnar, and inferior ulnar collateral arteries. These are the branches from the brachial artery, and the branches from ulnar and radial arteries are the radial and ulnar recurrent arteries, and posterior intraosseous recurrent arteries. These are the branches which actually anastomose at the elbow joint area. Radial artery, it is the smaller and lateral terminal branch of the brachial artery, which is present at the lateral area of the forearm, and it begins in the cubital fossa and passes below the brachioradialis muscle. It can be felt proximal to the wrist. Actually, the pulse that we felt, that the doctor felt at the arm or at the forearm area, is the doctor actually feeling the radial artery. So it can be felt proximal to the wrist between the tendons of the brachioradialis and flexor carpi radialis muscle. These are the muscle in between. In between these two muscles, the radial artery is actually present. It continues in the hand as the deep palmar arch. And the branches of the radial arteries are the radial recurrent artery, palmar carpal branch, superficial palmar branch, dorsal carpal branch, and the principal pollicis artery, radialis indicis artery, and deep palmar branch. These are the branches of radial artery. And if you will ask about the branch of radial artery, then you have to mention the deep palmar arch, and palmar carpal branch, and the superficial palmar branch. So you will label it. These are the, as I've already told you, the radial artery is actually felt between the muscles of between the two muscles are the brachioradialis and flexor carpi radialis muscle. So in between these two branches, the radial artery is actually felt. So these are the radial recurrent artery, posterior intraosseous artery, common intraosseous artery. These are the branches of the radial and ulnar arteries that have been shown here in this diagram. The other artery is the ulnar artery, which is actually the larger and medial terminal branch of the brachial artery. It begins in the cubital fossa and descends through the anterior compartment of forearm. It ends by forming superficial palmar arch with superficial palmar branch of radial artery. So in the hand, the deep palmar arch will be the continuation of a radial artery, and the superficial palmar arch is actually the continuation of ulnar arteries. So the branches of ulnar arteries are the anterior and posterior ulnar recurrent artery, common intraosseous artery, palmar carpal branch, dorsal carpal branch, superficial palmar arterial arch, and deep palmar branch are the branches of ulnar arteries. So as we are saying, the brachial artery is actually divided in the cubital fossa in the radial artery and ulnar artery, and the radial artery will be extended into the wrist area and into the hand area is the deep palmar arch. Here you will be seeing the radial artery is actually continuing of the deep palmar arch, and the ulnar artery will be like the superficial palmar arch. While these arches is actually due to the anastomosis, and due to the anastomosis occur between the branches of radial and ulnar arteries. The branch of superficial palmar branch of radial artery which actually anastomose with the superficial palmar branch of ulnar artery, and deep palmar branch of the radial artery is anastomose with the deep palmar branch of ulnar artery. So while the anastomosis occur, it will be look like the arches. So while the arches will give the different vessels to the phalanges, or the as you will be studying the like the it will be give rise to the common digital arteries to supply the fingers. So the veins of the upper limb, as the arteries carry the blood from the heart to the distal area of the body, while the vein will drain the area from the distal area of the body to the blood will be flow from the distal area towards the heart in the veins. So and the deep veins, it actually follows the arteries previously mentioned and are named similarly, while the superficial veins and the in the upper limb, it drain the subcutaneous tissue and eventually drain into the axillary vein. So the superficial vein drain into the axillary vein, and the deep veins will actually accompany the deep arteries of the upper limb. Superficial. What are the superficial veins? It is actually the palmar digital veins. Then there is a cephalic vein of the forearm. Then the basalic vein of the forearm, and the medial cubital vein, and the median vein of the forearm. These are the superficial veins, and these superficial veins will actually drain into the axillary veins that you have been seeing here. So here is the superficial venous palmar arch, and then the continuation cephalic vein, then the basalic vein, and the median antebrachial vein. While these two vein and the medial cubital vein will be continuous to the axillary vein to drain into the axillary vein. So the deep veins which actually accompany the deep arteries are the radial vein, ulnar vein, brachial vein, and axillary veins. These are the branches. These are the venous supply. This is the venous supply of the upper limb. So thank you.